Medicine takes a much broader view of sleep disorders such as insomnia, paying attention not only to the duration of sleep, but also to its quality. Insomnia is a pathological sleep disorder accompanied by its insufficient duration for full restoration of power, difficulty falling asleep, and also waking up at an early time. Sleep disturbances and insomnia include difficulty falling asleep. It is considered normal to fall asleep for a maximum of 15 minutes, while sleep disturbance stretches this period for several hours. Difficulty in falling asleep with a long period of drowsiness and anxiety occurs when the central nervous system is in an excited state. Difficulty in falling asleep is the most common complaint of patients. The desire to sleep that a person experiences before going to bed disappears under the influence of a variety of factors when a person lies down. These can be unpleasant thoughts and memories, the inability to find a comfortable position due to restlessness in the legs, pain or itching, extraneous sounds. Easy drowsiness is disturbed even at the slightest noise, and sometimes it seems to a sleeping person that he or she has not slept for a minute. There can be many reasons for such difficulties in falling asleep, in particular, insufficient physical fatigue, being in bed for a long time during the day, irregular bedtimes, anxiety, and various diseases. A frequent complaint is a discomfort in the lower extremities, such as goosebumps, trembling, tingling, stinging, twitching, which makes you change the position of the legs all the time. This is the so-called restless leg syndrome. Insomnia during restless leg syndrome begins to develop due to a feeling that forms deep in the calf muscles, which requires you to move your legs. Symptoms are greatly relieved or disappear with physical exertion and movement. Most often, the best effect is provided by normal walking. Recently, the proportion of patients who have problems with falling asleep due to the use of stimulating drinks in the evening, such as tea, coffee, and energy drinks, has increased. Healthy sleep is also interfered with by the abuse of drugs, such as caffeine, psychostimulants, some antidepressants, antipsychotics, nootropics. Short-term sleep is characterized by intermittently waking. The fragments of wakefulness between sleep are quite large. A person who wakes up in the middle of the night cannot fall asleep for an hour or two. In the morning, a person feels that the sleep was not deep, superficial. The reasons for waking up in the middle of the night can be very different. For example, dreams, fears, nightmares, respiratory failure, the urge to urinate. Very often, such awakenings are repeated many times during the night. Sometimes, patients mention that these awakenings occur at the same hours of the night. At the same time, many people note a feeling of unrest, anxiety with unpleasant bodily sensations, usually in the heart area. Patients report that they jolt awake with a feeling of strong palpitations or interruptions in the heart rhythm. In many cases, frequent waking at night is associated with sleep apnea. This respiratory disorder occurs during snoring and is characterized by short-term cessation of breathing. Sleep apnea is accompanied by a decrease in the level of oxygen in the blood and, accordingly, oxygen starvation. In sleep apnea, sleep is interrupted dozens of times a night. If you sum up all the cases of apnea and interrupted breathing during the night in total, a sleeping person cannot breathe for more than an hour. As a result, oxygen starvation leads not only to chronic fatigue, but also to serious diseases. There is also a long but superficial sleep, that is, the deep sleep phase is completely absent. In this case, a person, having slept all night, feels tired and not recovered in the morning. It is a well-known condition in which, even with sufficient duration and depth of sleep, the patient claims that they could not sleep a wink or spent a sleepless night. All the major sleep disorders described are never accompanied by a sense of satisfaction, do not bring with them a feeling of rest and restoration of activity. Often, sleep disorders are caused by somatic diseases, neurological and mental disorders, and then sleep disorders are a symptom of these diseases. Most often, it is a cardiovascular pathology, hypertensive disease, coronary heart disease, when there is nocturnal arterial hypertension or nocturnal angina attacks. Often, sleep disorders occur in patients with heart failure with improper treatment, so the correction of heart failure therapy can successfully regulate sleep disorders. Sleep disorders can also be caused by an increase in nocturnal attacks of bronchial asthma or exacerbations of chronic lung disease, various pain syndromes, in the elderly and senile age, most often with inflammation of the joints. Sleep disturbances can be a symptom of endocrine pathology and diabetes mellitus. For sleep disorders associated with somatic pathology, the most characteristics are superficial sleep and frequent awakenings, and not difficulty falling asleep. In these situations, adequate treatment of the underlying disease is of paramount importance, and the use of hypnotic drugs is justified only if the measures taken are unsuccessful, taking into account strict contraindications to the prescription of psychotropic drugs. Complaints about poor sleep are typical for patients with stroke, dementia, Parkinson's disease, Alzheimer's. Mental illnesses such as depression, schizophrenia, anxiety manic states are also accompanied by chronic sleep disturbance. Sleep disorders can be observed in people of different sexes and ages, but older people have these problems much more often than younger people. Insomnia is more common in women than in men, and in pregnant women it is observed in 75% of cases. Women are prone to the disease during menopause, when hormonal changes cause a thyroid surge in the evening and at night. This is accompanied by tachycardia, sweating, and inability to sleep. Experts also believe that the process of sleep and wakefulness depends on the constant interaction of the two brain systems. One system is activating. It maintains a sufficient level of wakefulness all the time, constantly slows down the neurons of the brain, forcing them to work at full capacity if you need to constantly solve some tasks during the day. On the other hand, there are sleep centers that are also not averse to seizing control of the brain. They are in constant readiness to take control of the brain, but they are prevented from doing so by the centers of wakefulness. The wakefulness centers are stronger during the daytime. They are helped by the inner clock, which receives information from the retina of the eye, which conveys information through nerve fibers about whether it is day or night, and whether there is enough lighting or not. The internal clock helps the waking system to maintain a sufficient level of activation in a person during the daytime. The struggle takes place constantly between the activating and inhibitory centers of the nervous system. When a person goes to bed and it gets dark outside, the help of the internal clock to the brain activation centers also decreases, and at some point, the sleep centers take control of the brain. This is ideal. But there are many situations when the activating centers are too active. The modern understanding of experts about the possibility of developing insomnia suggests that there is a group of people who have an innate feature called hyperactivation of the brain. Their hyperactivation can be traced even in the daytime, not only when they cannot fall asleep in the evening, and they complain of insomnia. Their brain is too active even during the day. This can be traced, for example, if an electroencephalogram is made in a group of such people. They have more so-called fast rhythms on the electroencephalogram than people who do not have insomnia. It turned out that people with insomnia have a constant hyperactivation of virtually all areas of the brain. They initially live with increased activation, which helps them during the day because they respond better to changes in external circumstances. They can concentrate faster and give the necessary response to some kind of reaction faster. But in the evening, when they go to bed, this begins to interfere with them because the activating centers of the brain prevent the sleep centers from taking control in time and returning the body to sleep. And when a person is lying down trying to fall asleep, he or she does not succeed because of this hyperactivity. Then the secondary mechanisms for maintaining insomnia are activated, and these are already various psychological factors. For example, a person lies down and gives him or herself a task to urgently fall asleep. I need to fall asleep urgently so that tomorrow morning I will be alert and well rested. It seems to be nothing special, But with such a task, the person begins to subconsciously track whether he or she fell asleep or not. After some time, he or she fails to fall asleep and begins to worry about it. From this, his or her brain activation, which is already high, increases even more. The person can feel sleepy even less, and the likelihood of falling asleep is less. The person becomes excited and begins to ask themselves, "Why am I not falling asleep? I need to sleep urgently." And the more he or she tries to put themselves to sleep, the less likely he or she succeeds. To be continued in the next episode. Stay tuned.